Please start. We are live now.
Yeah, good evening everyone. We are going with the third session for the day on the topic Iso-inertial exercise by Queen Elcy Prosper with Team ExRxIndia's webinar series for the students by the students. Miss Queen Elcy, you can start your session.
Okay, sir. Thank you, sir. Good evening, everyone. My name is Queen Elcy Prosper, studying BPT second year in Mahatma Gandhi Medical College and Research Institute, Sri Balaji Vidyapeeth University in Pondicherry. My topic today is iso-inertial exercise. Before going into this topic, I would like to thank ExRx for this wonderful opportunity, and I would also like to thank my coordinator, Dr. Murugaraj sir, and my HOD, Dr. Shanmuganath sir, for their guidance. Moving into the topic, these are all the topics we're going to see today. To give some introduction about the iso-inertial exercise, athletes experience muscle injuries during sports performances and during practices. And they also need flexibility, aerobic capacity, strength, and speed, which can also be improved with right intervention. So iso-inertial technology or iso-inertial devices are used to increase all these athletic or physical skills. And iso-inertial exercises is not superior to any other type of exercises. It is also equal, and it is also one other or one adjacent type of exercises which can be used to improve flexibility or aerobic exercise or strength and speed of athletes or other physical skills of the athletes. So iso-inertial exercise is mainly used in the field of sports medicine. Before going to see about the iso-inertial exercises, we must know all the other types of exercises present. So there are three types of exercises: isometric exercise, isotonic exercise, and isokinetic exercise. Isometric exercise is a type of static exercise. Isotonic and isokinetic exercise is a dynamic form of exercise. Moving on to isometric exercise, it is a static form of exercise in which a muscle contracts and produces force without an appreciable change in the length of the muscle and without visible joint mobilization. So as we see in the image, these are all types of isometric exercises. To give one example, if you take wall sit, taking the quadriceps muscle, the muscle does not produce any movement. That is, there is no change in the length of the muscle, but there is some tension produced in the muscle which keeps the position of the body or position of the individual intact. In isotonic exercise, a muscle produces tension resulting in the muscle fiber lengthening or shortening. Theoretically, under isotonic conditions, muscle force or tension is constant and velocity of movement varies. So in isotonic exercise, the length of the muscle changes, but the tension of the muscle does not change. So if you take isotonic exercise, there are two types of contractions present. They are concentric contraction and eccentric contraction. Concentric contraction occurs when the muscle shortens to produce a movement. For example, if you take biceps brachii, the muscle shortens, overwhelming the weight of the dumbbells to produce the flexion of the elbow. So that is called concentric contraction, and the muscle biceps brachii extends or lengthens to produce the extension of elbow, which leads to eccentric contraction. So if you take the squatting movement in quadriceps, when the person gets up or stands up from the squatting position, the muscle contracts, producing the concentric contraction. And when the person sits down to produce the squatting position, the muscle extends or lengthens to produce this squat position, which is the eccentric contraction. Moving on to isokinetic exercise, it is a form of dynamic exercise in which the velocity of muscle shortening or lengthening and the angular limb velocity is predetermined and held constant by a rate limiting device known as isokinetic dynamometer. So here it is also a form of dynamic exercise. In this exercise, the velocity or speed of the exercise remains the same, while in isotonic exercise, the velocity varies. So here the velocity of the exercise can be predetermined by isokinetic dynamometer, and it can also be held constant or manually change it according to our speed in the machines like treadmill or in stationary bikes. Moving on to iso-inertial exercise. Iso-inertial exercise denotes the type of resistance used in exercise training which maintains a constant inertia throughout the range of motion, facilitating a constant resistance and maximum muscle force in every angle. So as the term indicates, iso means same and inertia means resistance. So iso-inertial exercise is also a form of dynamic exercise, and here the resistance remains constant in throughout the range of motion. It increases the effectiveness of strength training by applying the inertia of a flywheel instead of a simple gravity to create optimal resistance. So here the type of the amount, the resistance cannot be changed, but the direction of the resistance can be changed. Coming to the basic concept of iso-inertial exercise, if a weight is placed on an extremity and the extremity is put through a range of motion. So the direction of the range of motion can be changed, but the force on the extremity doesn't change. So according to that, there is two components, concentric and eccentric components. Working principle is these iso-inertial devices use the flywheel principle to produce unlimited resistance during the entire range of motion. So instead of using a simple gravity to produce resistance, the iso-inertial exercises or devices use flywheel. So in the flywheel, there's a fixed shaft, and the shaft is connected to the harness worn by the individual by a curling or a pushing strap. So when the trainee or the individual does a movement, the fixed shaft rotates, which holds the flywheel, which produces resistance to the movement performed by the individual. Main mechanism of action is during the concentric contraction phase, the force applied unwinds the cord or strap connected to the shaft with the flywheel, which starts to rotate and store energy. As we've seen in the working principle, when the concentric contraction occurs, the cord or strap unwinds and it starts to rotate, which starts to store energy in return. So when the concentric action is completed, the cord or strap rewinds and the exerciser must resist the pull of the flywheel by performing a braking or eccentric muscle action. So it produces resistance to both concentric and eccentric muscle action. The flywheel does not require any type of gravity to produce resistance. It produces resistance on its own by our movement, by the individual's movement. So we all know, as I've said before, that um, iso-inertial exercise is used mainly in athletics or sports performances, but it is also used by astronauts. NASA and the international space medicine community recognized muscle loss and associated neuromuscular dysfunctioning following travel in spaceflight. So Berg and Tersch in 1994 found solution by describing how inertia of a spinning flywheel could be utilized to prevent these neuromuscular dysfunctions. So in astronauts or in space, there is no gravity. It is an anti-gravity plane. So traditional resistance exercises cannot be used because it is dependent on gravity. These flywheel exercises can be used there to prevent muscle loss and associated neuromuscular dysfunction, as flywheel does not require any type of gravity to produce resistance. These are all type of the exercise devices used in the iso-inertial exercises. The flywheel exercise device, which is based on yo-yo, and this is the versa pulley or the conical pulley. Both of them have the same mechanism of action. They rotate to produce resistance. The standard guidelines is iso-inertial exercise must be done with 4 sets of 7 repetitions, and there should be 90 to 180. There should be rests of 90 to 180 seconds between each and every set. And iso-inertial exercises must not be done more than twice weekly, and there should be 48 hours recovery between each sessions. Moving on, applications. As we all know, iso-inertial exercises is used for athletic performances and for space travels. It can also be used for geriatric populations and other patients in need of rehabilitation following muscle wasting or orthopedic or neurological trauma, and in preventing sports injuries. Iso-inertial exercise technology is beneficial in improving strength, power, and muscle mass, which improves the overall performance, and so it is used in sports medicine. So I conclude by saying that isonational exercise is mainly is used in improving the overall performance of sports professional, and it is also used in sports rehabilitation to understand and upgrade themselves and incorporate these technological developments in their routine practices. I would like to show this video. This video shows the application of isonational exercises in some of the athletic performances or sports. Thank you. So, as I've said, some benefits to athletes are maximal muscle recruitment, enhanced metabolic response, enhanced balance plus proprioception, increased muscle mass or plus explosiveness, synergistic activation of deep muscle tissues. So, these are all some of the benefits to athletes by performing isonational exercises. And also, our brain recognizes only the patterns or movements of the muscle. So the patterns used in sports can be improved by isonational exercises. Thank you.
Good topic by you, Miss Queen Elcy Prosper. So, to term out simple isoinertial exercise strengthens both muscles as well as your soft tissues. So, this is one of the best way to strengthen your soft tissue injuries or joint injuries. So, well presented, and I thank your principal from your college and your guide for helping you out to present this topic in a nice and neat way. Thank you, and we'll meet forward in future